Thank you for your interest in Bodhi Body. At Bodhi, we change lives. When we first set out to create this company, our goal was to create a whole new way to look at healthcare. We wanted to make people healthier and prevent disease. We wanted to inspire people. We wanted to show people that they could look and feel their best at every age. We wanted Bodhi to be available and accessible to everyone. And we wanted to create a healthy team and a healthy experience for all of us involved. We're going to talk about a few of our patients today. The first of which is Ginger. When Ginger came to us, she had multiple autoimmune conditions, one of which was Sjogren's syndrome. This is where the body doesn't produce enough fluid. She had seen 15 rheumatologists and they couldn't help her. In Ginger's own words, this is what she told me. I was in serious trouble when I came in. I couldn't stand up without having trouble breathing. I was using a breathing machine and a nebulizer. I couldn't concentrate. I couldn't do anything. I was ready to call it quits before I came to Bodhi. So when we looked at Ginger's care, we looked at the imbalances in the network of her biological systems. We looked at the digestive, the detox, the nutritional systems, and we addressed those with the treatment shown on the right. In Ginger's life today, she has a whole new life. Her autoimmune numbers are almost in the normal range. She's not taking any medication. And in her own words, this is what she said. I'm actually having a life now. I can think clearly. I can breathe. I can hike. I can go on vacation. We changed her life. So why functional medicine? We lead increasingly stressful and sedentary lifestyles. The pollution of the air and the water and the earth, it all leads to devitalized and dangerous food, which leads to overconsumption and rising rates of obesity, but undernutrition. We have fragmented family and community support systems. We are more vulnerable and subject to a medical system incapable of treating the whole person. So let's talk about Mary. Mary had been experiencing unwanted weight gain over the last few years, including an additional 25 pounds in the last 6 months. She had tried reducing the gluten in her diet, increased her exercise, but nothing was working. In her own words, this is what she told me. I had had a hysterectomy about 10 years ago and have never felt right. In the last year alone, I had put on 25 pounds and I was tired all the time. I had sleep issues and mood variances. So when we looked at Mary's care, we looked at the interconnected systems in her body. We looked at her diet, we looked at the detox system, the hormonal imbalances, and we addressed those with the treatment shown on the right. In Mary's life today, she's lost 46 pounds. She stopped taking her medication, and in her own words, this is what she told me. I couldn't be more pleased with the results. I still have more work to do, but I feel wonderful, and I'm confident that I'll reach my goal weight with the next round of HCG. I haven't felt better than this since before my hysterectomy 10 years ago. We changed her life. Do you think traditional healthcare is broken? We spend the most per person on healthcare in the world, over $6,000 per person in the US. Yet we rank 34th on life expectancy. We have over 43 million people uninsured. There's over 100,000 deaths every year from adverse drug reactions. And a third of the people born in the year 2000 will eventually have diabetes. So how do we heal? How do we do it? Well, we focus on the building blocks of health, the interconnected systems of the body. And we look at the underlying causes of disease, the why of disease, not the what of disease. We partner with our patients through education, support, community, and inspiration. So when Donna came to us, she had multiple health challenges. She was on multiple medications. She had been diagnosed with lupus at the age of 20 and had been suffering from that condition for over 40 years. In her own words, this is what she told me. I thought there was no hope for me. My fatigue was phenomenal. I had muscle and joint pain. After contracting West Nile virus, I had weight gain, fatigue, more pain, foggy brain. It was hard for me to get out of bed. I became frustrated and depressed. All I could do was go to work and then go to bed. I was losing my hair and I couldn't turn my neck due to the pain from arthritis. So again, when we approached Donna's care, we looked at her interconnected systems that were out of balance in her body. We took a look at the hormonal dysfunction, the detoxification, her digestive system, her immune function, and we addressed these with the treatments on the right. And today Donna has a whole new life. She's off many of her drugs, including the antidepressants. She has decreased pain, she has energy, and in her own words, this is what she told me. I now have a lot more energy to do the things I want to do. My whole life has changed. I've lost 44 pounds. My husband has lost weight. We make better choices. Since getting off the antidepressant, I'm like a different person. I'm now the person I used to be. My hair has grown back. The pain in my neck is gone. My lupus numbers have gone down so much they almost show up as normal. The ulcer I had in my mouth for years has disappeared. All of a sudden, I'm just feeling so much better and I have a better life. I'm very happy. My husband is ecstatic. My kids are amazed. My friends are blown away. So how do we do what we do? We start with comprehensive diagnostic assessment, which includes a detailed patient history, patient interview, physical exam, and a host of specialty lab testing. We take all of the information that we get from this assessment and we create an integrated treatment plan for each individual that encompasses all of the suboptimal functioning body systems of the person. We systematically follow up with each person and retest at set intervals and adjust the plan as necessary. And once the patient has obtained balance in the systems in their body, we focus on preventative care and optimal health with our True Health Plan. At Bodhi, we change lives.